are the Practical Medicine podcast presenters. I'm Dr. Stephanie Lipnicki.
And I'm Dr. Rob Balko.
And it's our goal to bring awareness about the many different ways to maintain health and heal your body, mind, and spirit, from acupuncture to Zen living and everything in between. So we're not just going to cover acupuncture and the different, modalities that we're trained in. We're going to have guest speakers and try and cover other topics to help maintain health. So as old as traditional Asian medicine is, I feel like a lot of people don't know all the things that we can do. So we want to share those things. And even in New Jersey here, not a lot of people. There's not even a lot of us. I think there's 1,100 acupuncturists here in New Jersey where we are. So.
And maybe not that many practicing.
Yeah, that's the other thing that comes up all the time. How many of them are actually actively practicing or just have their license? So I'm going to let you introduce yourself first, Dr. Rob.
My name is Rob Balko. I started actually my career as a programmer at AT&T. I got my bachelor's degree in math and went to AT&T Bell Labs and was a programmer for about 8-9 years, and then I got into network management, network engineering, and I went to a small startup and was traveling around the country a lot, traveling overseas a lot, living in hotels, eating a lot of bad food, and I got sick. And I came home, and we knew of a local guy we called the shaman. He was a former Catholic priest who was an acupuncturist. And I didn't know he was an acupuncturist. I just knew he was taking care of my kids at the time, who were 3 and newborn. And so I went to him and I started to feel better. We became friends. And I thought, wouldn't it be really cool to learn what he does? Because he's actually healing people versus covering up symptoms and stuff like that.
Right.
So I looked into the school and got all ready. I got all my paperwork ready to go. And I said, I can't do this. I have 2 little kids. This is irresponsible and selfish of me. And then I got laid off. So 3 or 4 months later, I started school in January of 2002, and been practicing for 15 years now, and I love it.
Cool. So I'm Stephanie Lipnicki, and I actually started on this path, I guess you could say, in high school. So I thought I wanted to be a physical therapist. I was pretty set on that was what I was going to do, and I was dating someone who his stepmother said, well, if you think you want to do that, you should go to massage school while you're in high school. And that was what I did. So my teacher was an acupuncturist, although that wasn't my first exposure to acupuncture itself. My mother had gone when I was a very young kid because she was super tiny, weighed 85 pounds after having kids. And she actually went for acupuncture to gain weight. And she did, not excessive weight, but enough weight that she didn't have to worry if she got the flu that it would do her in. And I fell in love with it. And at the time, I still thought I wanted to do physical therapy. And I, went to Kane for a couple of years and lost interest in PT, and then decided, sure, I wanted to go to acupuncture school. And I went and looked in New York at PCOM at the time. They were located in the Omega Institute. And they said, well, where do you want to practice? And I said, New Jersey. And they said, then don't come here. They said, finish your bachelor's degree, because in New Jersey, our standards are a little different even than some other states, and we have to have the bachelor's. So I did that at Rutgers, and then decided I was going to go to acupuncture school after I had kids. And then I had trouble having kids and thought, rather than stay home and be depressed, I had my bachelor's, and I figured I would go to acupuncture school then. So that was around 2001. And then a year into it, I got pregnant with my twins. So it took me from 2001 to 2009 to finish with acupuncture school. But in the interim, I was a massage therapist and an esthetician. And then probably around, I guess, 2011, I stopped doing massage and focused pretty much on the acupuncture itself.
That's great.
So, and I did the acupuncture and herbal program, but you just did the acupuncture program.
Right. Yeah, the Eastern School in New Jersey didn't have a herbal program at the time.
And now they do.
Right.
So, and we were talking about the first books that we read, and we actually did not read the same first book that made us fall in love with Asian medicine. So mine was The Web That Has No Weaver,
which is a fantastic book.
which you've read, but you said yours
Yeah.
was.
Actually, the first book my acupuncturist gave me was illegible to me. I couldn't understand anything that it was saying. And so I gave it back to him, and I was like, maybe this isn't for me.
Okay.
And then I saw this black spine book on his shelf that said Nourishing Destiny. And that
Okay.
looked kind of interesting to me, written by Lonnie Jarrett. And I read that, and it just blew my mind. And
Okay.
I don't know if you know Janice McKenzie, an acupuncturist from Pennsylvania,
No.
also a teacher. She lent me some tapes, audio tapes of lectures that he had done.
Okay.
And it really opened my mind to the full body focus of acupuncture. How
Right.
We're not just treating, a carpal
headache.
tunnel or a headache or
Right.
eye strain or migraines or insomnia or fertility even. We're really treating the whole person.
Right, because in this medicine, one thing impacts the other. They're not taking them as separate things, where a lot of times when you go to a Western practitioner, it's just the headache, maybe not the stress leading up to the headache, or the fact that your diet has been in the crapper for a year, and that the headache is coming from the fact that you're not eating nourishing foods. And so I actually have not read any of Lonnie Jarrett's books yet. And Anne Jeffries, who was one of my herbs teachers, who I loved in all of my classes, she talked about his books all the time, but there are so many books that I just haven't gotten around to reading any of his yet.
Yeah, there's a lot out there.
Yeah, but everybody speaks so highly of them, so they're on my to-read list. What are some of your favorite things to treat?
Some of my favorite things to treat. One thing I treat a lot is allergies. I probably treated 4 people yesterday for allergies. I have a system that is computerized, and we'll do a segment on that, where there's no needles involved, and it's similar to a lot of allergy systems out there, where we're exposing the person to a substance or a representation of the substance, a homeopathic representation of the substance often, and then a simple treatment down the spine, and I get huge results. The only problems I've had are with people who are overly exposed to something or who have a compromised immune system.
Kind of like a chemical exposure, or
Yeah, or just overexposure,
Okay.
like a dog trainer who's constantly exposed to different dogs
Okay.
over and over again, and they're predisposed to having some immune function suppression.
Okay.
Right? So you got immune and allergies kind of go
going hand in hand.
opposite each other, right? So that's one. Shoulder problems. I probably yesterday I treated 5 people for shoulder
Oh, that's great.
impingement, frozen shoulder, thoracic outlet syndrome, and I have this protocol I learned while I was at the Eastern School in 2003-4 that works fantastic, and it just. As soon as I hear shoulder, on the telephone, someone's calling about a shoulder, I'm like, come on in, I got you. I'm going to take
Right.
care of you. Yeah,
That's awesome.
yeah. How about you?
So I love treating gynecological conditions, anything from irregular menstruation to fertility concerns, menopause, and of course endometriosis, which I have, is one of my favorite things to treat because I like seeing people not so dependent on the Western meds, which are really just a Band-Aid to block the pain, and endometriosis is something without a cure. So
Right.
I love gynecological conditions. I feel like we're so trained to think that pain is normal, especially when it comes to GYN things. It's like,
Right.
just take this pill, just keep taking these pills, and
Yeah.
they're Band-Aids. It's not fixing what the problem is, and we have so many different ways of breaking those different gynecological conditions down and treating them. Like even someone who has painful menstruation, 5 patients could be in front of us and they're not going to have the same treatment because their diet might be different and their stress levels might be different. Their age might vary, but their chief complaint to us is the same.
Same. Right.
And I also like treating cosmetic, believe it or not.
Before we get into that, I just wanted to say it's great that you can relate to them because you've lived through it.
Right.
So that really helps put them at ease to understand, okay, she knows exactly where I've been
Right.
with this.
Yeah.
And the other point I wanted to make is I see so many young women who say, well, yeah, I have, headaches associated with my period, but my mom said that's just the way it is because that's what
Right.
her mom told her.
Right.
So
And
you
it's
have this.
not. It's not. Like,
Right.
there's this mantra, I feel like, in our medicine that painful periods are not normal. And it's like, you can't emphasize that enough, how just painful periods are not normal.
And
So,
we see in the news recently that women's pain is sort of downplayed, right? Ignored,
yes.
suppressed, or not even believed in some
Right.
cases. Right.
And then take into consideration other factors that I've been doing a lot more research to see across cultures that Black women will say they are dismissed. There's a historical component where it was believed that they didn't feel pain the same way. There's a lot of gynecological history of stuff that was done that we've learned from that was torturous to Black women at the time that it was done. So there's so much to it. And I like I like doing cosmetic acupuncture because there's this component that even though it sounds like it's a vanity aspect of it, if you look in the mirror and you feel good about the image that you're looking at, that you feel better all over.
Right.
And usually when we're treating, like comparing some of the Western modalities that you could look to improve your appearance, our medicine treats the whole body. Like even when I'm doing cosmetic acupuncture, yes, I'm putting needles in the face, but they're getting a body treatment every single time. So they're like, oh, I'm not getting hot flashes as much. Or I didn't notice this before, but now that I'm getting acupuncture, I realize that I did have digestive problems and now my digestion is better than it was before. So I like that component of it too.
There's a lot to be said for what's outside reflecting inside.
Right.
I read of a study back when I was in school about how they had people pose in various facial expressions for illustrative purposes. They were doing a book on muscle structure and stuff like that, and that the people who smiled were more than happy to come back the next day, but the people who were asked to frown or grimace really didn't want to come back anymore. They didn't even want the money
Interesting.
that they were being paid for the day. They said, "Listen, I'm out. I quit."
Did they had seen the images that people
No,
were
they weren't seeing what they were what was being drawn of them, but having frowned all day,
way it felt.
they felt miserable.
that's
So there's a reflection back and forth.
Right.
And even recently, there's other studies that show if you hold your arms above your head, it actually changes your physiology.
Okay.
And what do people do when they win?
Yes,
They
you're
put their
right.
hands above their heads.
Yeah.
Right?
Sports
And
teams.
It went even further to state that people who were born blind, who don't see all those visual cues,
Okay.
when they have a success, they'll throw their arms up.
Interesting.
Yeah,
I
pretty
didn't know.
fascinating.
That's so cool.
Yeah.
So, and the other thing, of course, now, and I realize that some people may listen to this on a recorded version, hopefully years down the line, but I feel like I see a lot of COVID stress syndrome right
Oh,
now.
yeah.
That people there's so many aspects to COVID that are causing stress. The mask debate about whether or not to wear a mask, which I'm going to put this out there that I am all for wearing the mask. I wear my mask to protect everyone else around me. Some people are working from home. Their children are going to school from home. So that's my, term that I've coined, this COVID stress syndrome that a lot of people are coming in with. And, in our medicine, we talk about how the energy of the body moves. When stress comes in, it messes with that pattern of how the energy moves and causes blockages and then creates other problems with sleep issues and anxiety and all of these other things going on. So just even to get acupuncture for the stress aspect, it's amazing with that.
Right, yep. And the isolation. I know some people who have not been back to work for 10, 12 weeks. They live by themselves. They really just go out to the store to get food.
Yeah.
Maybe go out for a drive, but there's nowhere to go.
Yeah.
So that has a major effect on the psyche.
Yeah.
Right. Which then, of course, then you're sitting at home. You're not really moving. You're not exercising. Your body needs to
Right.
move and exercise. Right. So you have all
Right.
this oxidative stress putting pressure on your body to function.
Right. And that brings up that whole thing that we're taught, the saying about how where there is no movement, there is pain. Where there is pain, there is no movement. So if you're more sedentary and you're not moving around, then you're going to have all these other things that happen with it. And I mean, I'm not going to lie, I was stress eating through the beginning of COVID. I think I gained maybe 15 to 20 pounds from like just eating crappy, disgusting food that then, for me, because of the endometriosis, creates an additional inflammatory component.
Right.
And then it causes me to have lower back pain and all this other stuff.
Right,
And I
right.
finally had to go, oh my God, you have to stop,
Sure,
stay away
sure.
from the sugar, stop
Yeah.
eating sugary sweets and get away from them, because it's just, I mean, we all love the way sugar tastes, but
It's crack.
it is, yeah, it's crack. It's the root of evil in my life, for sure, for sure.
Yeah. I treat a bunch of social workers, and they're all telling me, all their patients, they're doing Zoom calls with patients, and they're just crazy stressed out.
Yeah.
Right? That people who would barely have a drink are now drinking regularly.
Oh, wow.
Right? And then small children who are used to being allowed out and running around, they're really
They're
suffering
cooped up.
because they're restricted.
Yeah.
And it's just, they don't understand the whys behind that. They
Right.
could be told,
Yeah.
right? But they still can't reason, well, wait a minute, that doesn't make any sense.
Yeah.
So they struggle too.
And not being able to see their friends. I mean,
Right.
as adults, we want to be able to see our
Right.
friends, and kids want to be able to see their friends too.
Right.
So
Right.
that aspect. And even
Yeah.
them with the schools that are going back in person.
Yeah.
My kids are in a hybrid program, so they go in 2 days and they're wearing a mask. So I said, at one point, I was like, are any of your friends in your classes? And at first they couldn't really tell because they're seated apart from each other. And but mine are happy to be back in person.
That's good.
Yeah.
It's one of the reasons I set up in my office a stress express treatment. That's what I
I
call
love that.
Right?
I
It's
love it.
low cost, and it's simple. You know the protocol. It's all ear points, but it has an incredible effect on the sympathetic nervous system to calm people down, get things moving, flush out the toxins in the body,
Yeah.
and help them sleep better. And it's as simple as that, but it's as powerful as that.
Right.
It's great. Some people, they really key in on it. They have
Yeah.
their spot every week. They're there at 9 o'clock on Thursday or 11 o'clock on Wednesday, whatever it is, and they can't wait for that treatment. It gets them through
Yeah.
the week.
And that's the thing, and we'll get into that. The regularity is so important, especially with, during this time.
Yeah.
So what have you, used acupuncture for your own benefit and care?
Well, I had terrible back pain back then when I first started, and that was an incredible help. Really, what got me into it wasn't even the acupuncture; it was the herbs. It was the Chinese
Okay.
medicine that my shaman was using with me.
Right.
Was to clear out some toxins. As I said, I was eating horrible food and too much of it. I thought it would be, it'd be a great idea. I'll eat the fruit for breakfast at the hotel. Well, the food is
Okay.
really mostly melons and watermelon, a lot of sugar,
Yeah.
stuff like that. So I wound up really with like a sugar overload and a lot of inflammation in the body.
Yeah.
So that was a big help for me, right? And then I guess the next thing would be what we were just talking about is stress relief,
Yeah.
stress reduction. Having 2 little kids, being laid off, stuff like that.
Yeah.
It really got me through that. Yeah. How about you?
So for me, when I was in massage school, I did get treatments from my teacher. At the time, I didn't know I had endometriosis, but I knew that what was going on was not normal. Even though I had been to Western docs and they kept telling me, well, it's just painful periods, it's just painful periods. By the time I got someone to listen to me, I was 28. And when she went in, I think the doctor's exact words were she had never seen anything that bad in her life so far. It was such a mess. And it was stage 4 endometriosis at that point. So my massage instructor, I was doing acupuncture and herbs. And I agree with some conditions, it's the herbs are even more critical than the acupuncture because when we talk about the needles move things, but if there's nothing there to move, like if you're deficient, and so the herbs kind of build that up or get rid of what's toxic. And then I used it for fertility because with having the endometriosis, that impedes the process of getting pregnant. I eventually had to do IVF, and it worked on the very first cycle, and I attribute it to getting acupuncture once or twice a week in the whole year before. And I had to have surgeries. And every time I had a surgery, the doctors were always amazed at the recovery time given the nature of the surgical procedures that they were doing.
Yeah.
And I was like, yeah, it's because I did my homework before I came in.
That's right.
So it does. It makes you heal that much faster.
Yeah. That's a huge component of acupuncture, I find, for people, whether it's herbs or acupuncture, is post-op
Yeah.
healing. Yeah.
Yep. So much. And I mean, even my scarring is minimal. The most recent surgery I had, which I think, I was almost dead at the point that they did these surgeries. It took longer than I wanted to come back to work. I had surgeries in July and couldn't go back to work until October. But I think when I think of what happened, I'm like, yeah, I don't know if anybody else, if they weren't getting treated, would have been back to work as quickly. I was taking so many herbs to build back up all the blood that I lost. So I feel like if you're going to have surgery for anything, you should be searching out an acupuncturist and getting treated ahead of time and seeing what herbs you can be on to heal from it that much quicker.
Absolutely.
So I think we should talk a little bit about what our medicine includes. Even though the future podcasts are going to talk about other ways to stay well, I brought some of the tools, and Rob brought some tools that we're going to show everybody. So obviously, acupuncture and using needles is one of the primary ways. So, and I know from far away the camera probably can't see, but there are 10 needles in this pack. I'm going to open it up. And the emphasis for me is that from this far away, you can't even see it. When people are afraid of what we do, I'm like, the needles are as thin as a strand of hair. Do you tube needle or do you freehand?
Freehand. Most
See,
of the
I
time.
freehand too. So the needles come with a little tube, which that might be a little bit more visible than the needle is because it has a color to it. But I don't use the tube. I just use the needle. And this was one of my favorite things when my kids were little, because I was in school when they were little, was that I would go in and my daughter would let me needle her in front of like her whole class. And they'd be like, oh, doesn't it hurt? And so it really doesn't. I mean, you barely feel it. Even when you hook up e-stim, it feels really good. And, when I pull it out, my arm is not bleeding. It's totally safe. They're single-use disposable, so I'm going to throw this in my little container that I have for my used needles. And when I do cosmetic acupuncture, the needles are even tinier. They're like, I think 5 millimeters goes into the skin. It's really insignificant. Yeah.
And they're even thinner. So there's two aspects to a needle, right? The length of it and the thickness of the needle itself.
Right.
And facial needles or ear needles are so thin that you can't put them in without a tube sometimes.
Yeah.
Right? Like a lot of the Syrian ones. So you tap it in with the tube and then you try to push a little further, and sometimes it's hard to get it in any deeper than that,
I think the only ones I use a tube with are those
super long ones.
The super long ones when you put them in the butt muscle, because I feel like it's so long and I don't want to touch the entire length of the needle.
You mean the gluteus?
Yeah, the gluteus muscle.
For the
Yeah.
anatomist following
Yes,
along
for
here.
those who are versed in anatomy, the gluteus maximus and minimus.
There you
And
go.
the bigger, the longer the
People.
needle. Yeah. When you have a lot of cushion back there, like I do, you can use a bigger needle there.
Yeah.
So another tool that do you do gua sha at
little
your
bit,
clinic?
yeah.
So this is a flat little piece, and you use this to do a technique called gua sha, which is a scraping along the muscle. So usually I use a little bit of massage oil. And the most common areas I use this on are the back, neck, and shoulders. And you do this scraping technique, and you do it until the skin gets very, very red and looks almost like it has a rug burn on it. So, and it doesn't take much. I mean, not that you can see on camera, but my skin is already getting fairly red. I just love the way it feels. And I used this on my kids when they were little. That you learn in pediatrics, at least at PCOM we did, that you can bring a fever down on little kids by scraping along either side of their spine. And you could, I've taught parents to do it with their fingers, to just repeatedly go like this on either side of the spine. And it works. It's worked in my kids to bring down a fever. So then The other favorite of mine is cupping. I love cupping. Do you do fire cupping or?
I love cupping. 'Cause I
Yes,
have a
and love cupping.
heart-shaped cup.
These are little heart-shaped cups. And actually, I think it's Tanisha Dandridge she's started with, she's going to be selling star-shaped cups. Hers aren't going to be fire cups. They're going to be the one with the like pressure pump.
Yep.
Do you do that or do you do fire?
I have both. Yeah.
Okay, so I don't. I only have fire. I'm like a child. I like playing with fire.
Well, who doesn't?
So I always use the fire cups. But the love cups make a little heart-shaped demarcation or, the energy that comes up. And cupping, I feel like recently was made, kind of brought attention to because Michael Phelps showed up at the Olympics with a lot of cupping marks. So, which was great for us. I
Sure.
mean, I feel like it opens up the conversation with people and
Right.
it was really cool.
Yep. And they have a nice little bottom there.
Yeah.
You know, they're also now being used by hipsters as whiskey glasses.
Stop, for real. I haven't
I
seen
kid you.
that.
I kid you not.
That's
So
kind
maybe
of
that'll lower the price of them with
expensive. Yeah,
more
maybe.
production. Who knows?
Who knows? Yeah.
Yeah.
So do you do Moxa? I do Moxa as well. So I don't do the kind that's as smoky because I do have other people in the building where I am. So this is smokeless Moxa, which some people either don't like that you're using it or, sometimes you get a little flack for being someone who uses smokeless Moxa.
Who's giving you the flack though?
I've in groups.
Right. Well, that doesn't matter because what matters are the patients.
Right, and it works. So I use this a lot. If with fertility patients, if their belly is cold, there's that saying that you want this warm and fertile uterus. So I like using Moxa on the belly for that. Even if a baby is not breech. When I'm getting my moms ready for labor in the weeks before they're supposed to go into labor, I still do it on UB67, even if the baby is not breech. I feel like their labor is smoother. They need less drugs. They report back that they feel like they've dilated rather quickly when they compare their births to friends' births. Not that we should be comparing, but they'll usually come back with a second baby because they feel like their labor was so good.
Yeah.
I don't do a lot of
That's
tween
great.
knot. Do you?
I would just add to
sorry.
that. I can see the point of that, where you're warming the muscle tissues, right?
Right.
The uterus is incredible, right? It starts about this
Yeah.
big, and now it's holding 6, 8, 9 pounds of baby plus other stuff, fluid,
Yeah.
placenta, and yet now it needs to relax.
Right, and let go.
Warmth is going to help it relax. That's, we'll get into heat, cold, and dry, damp stuff, which is a major part of diagnosis in
Right.
Chinese medicine. So people will understand that a little better. But you're basically warming the muscle. It's like, doing some stretches before
Yeah.
you run a marathon.
Yeah.
Because for some, it's like a marathon.
Right. So I use a lot more of it in the wintertime too. I've also done,
sure.
I have they call it a tiger warmer where you put the thinner stick
yep,
in and I
yep.
do it like on the back of
Nice,
the neck
yeah.
where wind would get in and cause trouble.
I had a patient asked me to purchase one for her.
The tiger
so she
warmer.
could take it home. Yeah. No
I'm
problem.
always
Sure.
so like afraid of doing that because my mentor once told me this story about she sent someone home with a Moxa stick and a drawing and everything, like saying
boy.
this is and when they came back, they're like, "Am I supposed to touch the skin?" And she was like, "Give it back to me." She's like, "You can't have this anymore." I was like, "Oh no," and I'm always afraid that would be me. I'll give it to somebody, they'll burn
And
their
they'll
house
burn the
down,
house down.
they'll burn their skin. So it doesn't actually, it's lit on fire, but you're not actually touching it to the skin. You hold it over the skin and warm specific points.
Right.
Also really good on the point, there's a point on the leg that I feel like it's the most important point. Like if you're only going to needle one point, stomach 36 is
you
like the
go.
point that you would needle. So it's on the outside of the leg. So I feel like Moxa is really good on that
Sure.
point.
Yeah. And that's a really good point today for immune boosting,
Yes.
right? While we're concerned about viruses and things like that, it's for stamina. Right?
Yeah.
But more than anything, immune.
Yes.
That's the big thing. If there's one point I teach people about, I show them where that is.
Yeah.
And I have them moxa it, or I have them at least stimulate it with their thumb or something like
Yeah.
that. Yeah.
Such a great
And
point.
do it for their kids too.
Yeah.
Yep.
You do more of this than I do, Tai Chi and Qigong. I mean, I did it as part of school. I loved it. And I don't know if because of where I live,
Yep.
where there's not really classes and I don't feel equipped to teach it.
Yeah.
I think Tai Chi and Qigong are so fantastic for moving the Qi and staying healthy.
Right.
And you do more of that than I
Yeah.
do.
Yeah, I've studied overseas in Thailand and Bhutan with some people with that, also in the United States. And it really encompasses the entire body and the mind and breathing.
Right.
Just as an example, you might have a certain movement in your hand, and what you're really doing is stimulating the channels on the arm, which then relate to the lung, the large intestine, et cetera, to open up that channel and get things flowing.
Right.
Breathing techniques will actually elicit in the body a release of gases that your blood chemistry needs to
Right.
function better. That will help suppress the stress response, stimulate the parasympathetic nervous system, which is your rest and digest system, right? To
Right.
help you better digest food, sleep better, things like that.
Right.
And of course, with that focus is the mind focus, and I'll use some of that actually to sleep when I have trouble sleeping. I can engage some of that and put myself
Quiet
to
the
sleep
mind.
in 3 minutes, 5 minutes, something
That's
like
great.
that when I really need to. And there's so many different styles, but my suggestion with people is pick anyone. It's
Right.
in that regard. I don't want to compare it to yoga, but it's like yoga in that regard. Get started, just do a little bit of it.
Right.
See, and you'll feel the benefits. You'll feel the results of that. I actually have a guy I know. He created a whole series of videos online, and you just purchase that one time, and you have it forever. So
That's
you can watch it
fantastic.
from your phone. You can watch it from a laptop. You can cast it to your TV.
Oh,
If
that's
you want to
very
get
cool.
a bigger example, and he'll show you the pose and the movement from the front and then from the side.
Oh,
So you know
nice.
exactly the way you're supposed to be standing, whether your knees are bent a little bit, whether your hips are bent a little bit or not. You want to be nice and relaxed. So you can
Very
see all
cool.
that, which is really, really helpful.
That's great.
Yeah.
That's awesome. What about Tuina?
I don't do much tween on.
Neither do I.
Yeah.
I think because my background was in massage,
Right.
and I just.
Well,
I
let's talk
feel-
about what tween on is.
So I feel like it's a more intense technique. A lot of it is at the tendinal attachments and like plucking the muscle and pulling at it. And one of my teachers who had passed away after I graduated, she was very into it. It can involve bone setting. I think it's associated very closely with a lot of the martial arts forms because of the broken bones and the bruising and getting people back on the floor to do those sorts of.
Yeah, I think it's like Thai massage in a way. It's not relaxing.
Yeah.
It's not Swedish massage. It's not something you fall asleep
Right.
getting. You endure it.
Right, and I feel
but it's very therapeutic and helpful.
And then when you compare it to like shiatsu, I feel like shiatsu focuses more on, the channels, and it's even different from that as a technique. Yeah. And I mean, like I said, I came from a background of being a massage therapist for so many years. I think by the time I got there, to school, I was like, really? I don't want to learn any more massage techniques. I'm done with this. Can't we
Right,
learn something new?
Yep.
And then I just also brought some tools that I have that when you treat pediatrics, little kids, they don't always let you put needles in. So
Sure.
there are little tools that they have. And I apologize for anyone who's going to listen to this and not have the visual because you won't get to see this. But they're little, this one is like a roller with spikes, and you would roll it on their skin, and again, scraping like you would with gua sha, poking on the points a little bit. I've started with this and then usually been able to work my pediatric patients
Yeah.
up to the point of getting needles. And
What age would you say that is where you start to put needles in kids?
well, I mean, so I used to bring mine into the pediatrics class,
Yeah.
and Melanie Caton was the instructor. And she used to tell the class, you cannot go by these kids because I think around 4 or
Yeah,
5 you
right.
can get them needled. But
Right.
like my daughter would ask for it at the age 3 because she grew up with me doing all of this.
Right.
And, you know, she would come in the room and say, I want it at this point. So, I mean, you
Right.
can start at 3.
Yeah.
You can start
the
massaging at a
typical
baby's
child
age.
who's not used to any kind of or really
Anywhere
their
between.
experience, like let's look at a typical American kid, their experience is going to be going to the doctor and getting a
Right.
shot.
Right.
So needles are out.
Well, so that's an even funnier story. So my daughter in kindergarten, they had a picture of a doctor giving a shot, and my daughter drew like the cartoon bubble around it, and it said, "Oh, cool, a shot." And the teacher was like, "If you know, because I know what you do, the context of it makes sense." But she said no other kid was
Right.
going to write, "Oh, cool, a shot," because
Right.
my daughter associated needles with my needles, not the
Right.
shots from the doctor's office, because
Right.
this you're doing more frequently. And most of the kids I treat, it's ADD, ADHD, and allergies. Those are the common things with kids
Yeah.
that I see.
And I would venture to guess these tools that you're using, right, with them are very effective, and you need to do it very little.
Yes.
Short
yeah.
duration, right?
Right.
First of all, their energy is super vital, right?
Yeah, you
It
don't
doesn't,
need to do
doesn't
a
take
lot.
much to redirect it.
Yes.
Right.
Very little
So
when
they're,
you're
they're
doing kids.
you know, you're spending more time probably corralling them and
Yes.
talking to them and talking to mom.
Drawing on the
know.
table paper to try and keep their attention.
Right.
Yeah, their
Yep.
treatments are very short. And when you do start needling in the beginning, you're just putting it in and taking the needle out. You're not, there's no retention where when adults come and see us, they're laying on the table for a period of time.
Sure.
Which kind of segues into how long our treatments take. So when we talk about an intake for a patient who comes into our office as a new patient, their first visit might be 60 to 90 minutes. And I loved your analogy with the time spent with a Western versus
Right.
an Eastern practitioner.
Which is typically when you go to a Western doctor, you go into the office, you sit down, wait in the waiting room for about 45 minutes, see a doc for about 5 minutes, and you're out the door.
Right.
And in our offices, you walk in, and before you know it, you're in a room, and you spend about 45 minutes with us, and then you're out the door.
Right. And you're getting a treatment for that time.
Right.
So, and I mean,
So you're not waiting for 45 minutes
Right.
in the room or anything.
where then they go in and they take your blood pressure, and your blood pressure is up because you've been sitting in the waiting
Right.
room for
Looking
45
at
minutes.
wondering if you'll make it to your next,
Right.
commitment for the day.
I just said to someone, I waited in a GYN office once for an hour and a half in the robe, and I was like, I'm just going to get dressed again. Like, why am I sitting here like this? And I get that they had an emergency, but I probably needed 5 acupuncture treatments after that visit.
Right.
So, and some of the other things that we do when we're doing our intake, similar to when you see a Western doc, like with the shoulder stuff, I'm assuming you do a lot of orthopedic tests.
Sure.
Yeah, take them through like range of motion
Right.
and
Right.
that sort
Assess
of
them.
thing.
I have a nice long hall. They'll walk down. I'll see their gait, if they're carrying anything or holding anything, and of course, like you're saying, the orthopedic assessments would be done
Right.
too. The rooms I have, one I have has no windows, which for some people is nice.
Yeah.
I used to have all my rooms had no windows in another place, and people love it. They're in the dark, or they'll say leave a little lamp on or something
Yeah.
like that, and I can have like a little night light, or I can have full light. I'll leave a door open for someone if
Yeah.
they're a little claustrophobic. They wouldn't leave the door open. But there's artwork on the walls. I have heated mats on the tables.
Yeah.
I have biomats,
I
which
love
are
the heated mat.
it's an infrared mat
Yes.
with a number of different minerals on it. Tourmaline is one, and the main one is
Amethyst.
amethyst.
Yeah.
Thank you. I almost
The
forgot.
amethyst biomat, yeah.
People love it. They swear by it. I actually have that as a treatment by itself. For some people who want to just come in and do that, they don't want to do the needles, or they don't want to spend that much money, and we'll do that. So that the experience is a lot more
Yeah.
comfortable for
And
them.
music. We have
Music.
usually most of my patients opt for having music on in the room. So it's that whole relaxing atmosphere. And so our intakes are in depth in the sense that we're looking at a patient's tongue to see what's going on with their digestion, how hydrated they are. So things that, when your Western doc looks in your mouth, they're looking to see the state of your throat, a little bit of the tongue, but we are looking at the tongue a little bit more because we can
Sure.
make an assessment about what's going on a deeper level. I do a lot more with the pulse than the tongue. The quality as it moves through the body. So where a Western practitioner is feeling the rate, we're feeling the quality, and there's all these different attributes, like is it thin, is it full, is it deep, is it towards the top, is it robust, and those kind of,
Wiry,
Yeah.
thready. It's like any capability. People will say, how can you tell that? We'll say, well, we've been checking pulses for 15 years and 20.
No, well, so I didn't start around the same time.
Okay,
Yeah,
so about
in
the same
terms
time,
of the
right.
the Asian medicine. Yeah.
It's like anything. It's like when you walk in your shoes and you can feel something on the ground, you develop a
Right.
sensitivity, like anything. Like when we find points on the body.
Right, that are
I
more
just told someone
tender.
yesterday, I said, in a perfectly healthy body, you can't find the point because there's no deviation in the skin and the muscle.
Right.
Right. So, but we developed those capabilities from doing this over and over and over
Right.
again. Yeah.
But where we also have to be we have to study an equal amount of Western medicine, because most people
True.
are coming in with a Western diagnosis. So I don't know if everybody realizes that in getting to the point where we are licensed, there's a huge amount of Western bioscience classes, the anatomy and the physiology, the pathophysiology, and
Palpation.
yeah, all of those classes that we have to be well versed in addition to all of the Asian medicine aspect of it.
Hence the gluteus maximus and minimus,
Yes.
not the butt muscle.
Yes. We were just talking about languages and what language you picked to study. And so when I went to look at PCOM, they had said if you have to take a language when you go back to where you're going, they said if the school offers it, take Chinese, which it was super helpful that I had
Sure.
a year of Chinese, because then you can see in the names of the points and in the herbs and all of that. But if I had known the amount of Latin that
Right.
we would need to know, I think in high school I would have taken Latin
Right.
as opposed to French, because
Right,
I
right.
don't think that did anything for me in the long run, other than it sounds beautiful, but I don't think I sounded
Right,
beautiful with
right.
it. Like, there's so much, and someone was like, is there really that much Latin? And I'm like, every single muscle, all these different, anatomy and physiology aspects. And then when you get to herbs, you're learning the pinyin and the Latin and what it translates to in American as well. There's all
right.
those parts of it, and having to study where they go. And
Yeah.
so, yeah, I think there's a lot more involved than people realize. I mean,
Yeah.
I get did you go to a weekend class for this? And I'm like, no.
Right.
I'm like, I mean, now both of us have our doctorate, but minimally you have to have a master's degree. And then, like we were talking about in New Jersey, you have to have a separate bachelor's degree from the one that the acupuncture school issues to you. So it's a
Right.
lot of
Yep.
education. It's a very high standard that we're held
People
to.
ask me, and I say, well, it starts with a bachelor's degree, which you need some of the sciences, biology,
Right.
chemistry, physics, maybe. Well, I think my physics was allowed or something like that.
Yeah.
And then you get to acupuncture school.
Right.
And really you do a pre-med.
Yeah.
Right? Because I had to go to the local community college and take part of the nursing program.
Right.
And then you study Chinese medicine, and
Right.
you learn everything from the Chinese perspective. So we have a basics in Western medicine,
Right.
at least at the basic nursing level.
Yeah.
And then we've got the Chinese
Right.
diagnosis, which is a whole different animal,
Right.
like we've said, with the tongue and wet and dry and hot and cold. And
Right.
then there's the pulse. And there's so many other factors, right?
Right.
Just
Yeah.
listening to people and talking and the tone of their voice,
Right.
and the shape of their face, and,
Yeah.
and even their hands and stuff like that.
Yep.
It reminds me of that. The thing people say, when you don't understand something, it appears like it's magic, right?
Right.
But when you really see the full system, you realize
Yeah.
Chinese medicine really is a scientific system.
Right.
That's it's very systematized. It's
Yes.
not like, I felt a ghost in the room, so I'm going to do this.
Right.
It's really not the way it works.
Right.
And if there's an acupuncturist out there telling you that, you can go find somebody else. If you believe that, please
Yeah.
enjoy that experience, and I
Right.
hope you benefit from it, and maybe you will, and I don't see any problem with that. But
There's a lot behind
Chinese
it.
medicine is a very systematized, scientific, structured
And I do think in terms of science, that's one of the things that I think are like from when I first started in acupuncture school, there were not a lot of studies, and the scientific method of certain things and the way a Western model works when they're doing research doesn't always work for us because again, 5 people can come in with a headache. They don't all need the same points. So then if you get results that study didn't work, did it not work because you didn't use for their pattern? They're not distinguishing. But I am seeing more, especially when I did the doctorate, when I was doing a lot of, I did a lot of my papers on endometriosis because that's so near and dear to me. And the amount of articles that pertained to acupuncture and endometriosis that were out, that they were showing that in studies that acupuncture was more effective than non-steroidal anti-inflammatories, NSAIDs, in the sense that there's a cancer marker that they use, CA125, which is, it's not specific to endometriosis, but it can indicate endometriosis or ovarian cancer, and that patients with endo who had acupuncture, that marker comes down. You're not going to get that with an NSAID. So it's fantastic that you can find more scientific research now. But at the same time, this medicine is so old, I feel like, why do we have to justify it? But that's what they want for, you know, to be accepted.
Well, my feeling about why do we have to justify is the perceptions. That's what you're really working with, right?
Right.
Is things exist whether you believe in them or not, and then once we prove that they exist using a certain model, then people buy into it and they say, okay, I can believe that because this is the model I live by. You know, reproducible, you know, scientific method, right?
Yeah.
But after a while, people start to say, well, I saw it happen to my mom. I saw it happen to my uncle, my sister. My wife's now pregnant.
Right.
You know, we have 3 healthy babies or something like that.
Right.
And they say, you know, I had a patient who had Bell's palsy, and he said, if you told me to stand on my head and reach for my toes, I would do it because this worked for me.
Right.
The results are there. You can't deny them.
Right.
What was different between, you know, last Saturday and today in this person's life was he got acupuncture.
Right.
And now his face is not paralyzed anymore.
Right. But at the same time, one of my favorite things is when people try everything and you know that what you're doing has made a difference and they're like, I feel so much better, but I have no idea why.
Yeah, it could be. It might be. I don't know.
I don't think it has anything to do with what you're doing and what you've done in the last 4 weeks. But
I see that as an evolution, though, because the next time they come, they say, you know, I'm feeling better. And then they start asking other questions like, do you work on my wife's problem, you know, or something like that. It turns out that now they're starting to think of their friends who can benefit from this.
Yeah.
And then they start coming in. And next thing you know, you've got, you know, a believer or a benefactor.
Right.
You know, someone who will really go to bat for you.
Yeah.
With my allergy treatment, I had somebody who was hemming and hawing on it, but she was getting acupuncture. And she said, okay, let me try it. And 2 or 3 treatments in, we took care of her pollen allergy and her weed allergy. And next thing I know, she sent a friend of hers, and then she sent another friend of hers, and that friend's son is coming. And then that person, the one with the son, she just said to me yesterday, she said, I'm having someone else come in to see you.
So it's the commercial that was popular for the shampoo when we were kids. And they told their friends, and they told their friends, and so on and so on.
That's it.
So one of the things that I also wanted to talk about today was how we operate a little bit more on, well, we try to, on a wellness model versus the sick care model, that we want people coming in, like the person who's sitting at home and thinks, well, there's nothing I'm really thinking of that I can, what do I need acupuncture for? Everyone can benefit from it. I don't know anyone who doesn't have stress. Yeah. And I was reading Carrie Fisher's book, Wishful Drinking, and I liked this quote. A problem derails your life, and an inconvenience is not being able to get a seat on the derailed train. So I feel like come in before you're on the train that has crashed, get a seat on the train that there is, and hop on the path to wellness first.
Right.
And we see this other one all the time. I see it in memes everywhere on social media. If you don't take time for your health, you'll be forced to make time for your illness. So we want people coming in before it's, because the longer people wait, at least in my experience, and I'm going to assume it's the same in yours and other acupuncturists out there. If you've had something for 6 months, I am not getting rid of it the first day that you come in. Because if I was that amazing, and you and I have talked about this, I would charge $1,000 a visit, and I would work 1 day a week, and I would be in the Bahamas sipping some sort of fruity, drink the whole rest of the week. So I feel like, it definitely takes longer the more someone is into an illness and they've, searched out all these other methods and we're their last resort, and they want it to work, because the Western model is you go to your doctor and they give you that magic pill, but then the magic pill doesn't necessarily work. So I feel like, that whole aspect of it.
Yep. Yeah, that was my experience. The magic pills didn't work for me. So when I found this, I thought, wow, I finally found something that really makes a difference in people's lives.
Right.
Yeah. So,
and that realistic expectation, though, you didn't go and feel better from one visit.
Right.
You were probably seeing him for a while for the back pain, and it didn't go, didn't help with the digestive stuff too.
At one point I said to him, after maybe a month or something like that, and in that month I had lost 15 pounds, I was sleeping better, all my symptoms were going away. I said, how long is this going to take? Because that's really what an American thinks, right?
How long is it going to take?
When are we going to be done with this?
Instant gratification.
And he said, 3 months. And I said, why so long? And he said, because your body is healing itself. And the light bulb went off in my head of like, oh, this isn't an outside thing. This is really an inside thing. Is my body is we're turning the ship around, so to speak, right? And a big ship doesn't turn around on a dime.
Yeah.
It takes time. But when it's turned around, now it's turned around. And it's much more healthy.
And I also feel like that plays into, like, because I do get that life gets in the way. Someone who has been in to see us and gone through that, and they maybe fell off their maintenance plan, I feel like it's usually easier to get them back on the path when they come back versus that first time that they came in and had something where they're like, I've had headaches for 10 years and no one could explain why, and maybe it took 3 months to get it under control. And I really feel with gynecological conditions, that's definitely, it takes about 3 months to regulate the cycle.
Absolutely.
Because you have to have one cycle and see what happened. Did it make the, did the bleeding go away, and that kind of thing.
Yeah. Well, and some of that goes into really the how we're still connected to Western science, for lack of a better phrase, because it's all about cellular regeneration.
Yeah.
Because you can't rebuild a uterine lining in a week.
Right.
It doesn't work that way.
Right.
Your blood cells last for months.
Right.
So you're not going to cure a blood or change a blood chemistry issue overnight.
Overnight, yeah.
Bones. Cells last a lot longer.
Right.
And we are really stimulating osteoblasts to create new bone tissue.
Right.
That's one of the things the laser does.
Yeah.
We'll get to it another episode.
So we were talking about insurance and packages and treatment protocols, and I think this is the other hard thing when you're putting this model into play, is that everyone pays so much into their insurance and comes in and assumes that their insurance is going to cover what we do. And most of the time it does not.
Right.
I mean, I took my first insurance billing class back when Hurricane Sandy happened. And I remember only because the hotel was on a generator, and it was held by one of the main liability insurance companies that we use, like a lot of practitioners use. And the person who was hosting had said, only 1% cover nationwide. And, once it jumps to 2%, you'll have all these people coming in your door. And what we've seen in New Jersey is that companies, particularly, there's one big one that covered pretty well, has been lowering reimbursements. And when you do the numbers, I'm like, well, my standard of care is I reserve an hour for a patient. They're usually in and out in 45 minutes, but especially with GYN conditions, a lot of times there's a lot of tears, and I don't want to tell somebody, shut up, because I want them to let it go. And I think I did the math, and I would need to see 108 patients a week, which is not for me. And there are models that operate that way, and I'm not downplaying that, but I see a lot of complex cases, and I don't like an insurance company dictating to me how my patient's care is going to be. So we were talking about that. That's, one of the things that we explain.
Yep.
And I liked how you had said it, that, maybe they'll cover some of it, but
Yeah.
chances are they won't.
Yeah. Unfortunately, the insurance company has your money and they don't want to give it back to you
Right.
as
That's how they make their money.
a subscriber, right?
Yeah.
So, I do what I can to help them, but at the end of the day, I need to make a living and pay the rent.
Right.
So I'm moving to a model where, I charge what I charge and I will even submit for them,
Right.
but they'll get reimbursed.
Right.
Because very often I'm not in any networks.
Neither
because,
am I.
Which is another story. But I'm not in the network, so they'll get the check back because I'm not in the network.
Right.
And I'm not in the network because they pay so little. And now
Right.
I'm waiting for that money, and then it gets denied. And it's such a hassle
Right.
for me that I would actually have to hire somebody
Right.
to do all that. And now that will drive my costs up even further.
Right. Or then you have patients, not that it happens often, where they just don't even bring the check to you. And I'm like,
Right.
hey,
Yeah.
I have kids that don't eat the paper that I write my notes on. Like, are you out having dinner on, my work time?
Right.
So yeah, it becomes this thing where you don't want to have to chase them down. It's this element of just dealing with it that way. And like, sure, I'll submit as a courtesy,
Right.
but when you come in, you can write me the check then. Or,
And that's why I try to bring it back to the well care that
Right.
we were talking about, right? Is that we want to help them take care of themselves
Right.
and couch it more like we're the insurance, right?
Right.
By coming to me, you're actually
right.
investing in yourself that
Exactly.
you're not going to get sick. And I have so many of my patients who tell me that, right?
Right.
Everyone else in the office or in the classroom or somewhere are sick this week, but I'm not sick at all.
But you're not even treating them for that necessarily.
Right.
It's just
Yeah.
this bonus side effect
Right.
of that they are healthier because they're getting acupuncture. I feel like we hear that so many times. Like, I'm treating someone for lower back pain, and they're like, hey, normally at this time of the year, I've been sick
would have,
twice.
right.
I would have had this, that, and the other thing. Do you think it's the acupuncture? Yes. Yes, it is.
Yeah. Yep. So, it's an investment really
Yeah.
for them. And that's the mindset shift that's on us and them to focus on is,
Right.
do you want to take care of yourself or do you want to chase after $40?
Right.
What is it worth to you to feel better? Like my shoulder patients this week or my allergy patients, for them to not have to take or go find drugs so they can breathe,
Right.
to have to close the windows all the time because the pollen is
Or not
blowing
be able to
around.
go outside because
Right.
the pollen is blowing around.
Go from the house into the car, close up the windows, put on the air conditioning because of that sort of stuff. Or the cricket player who I'm treating, who wants to get back to playing cricket. It's driving them nuts.
Right.
That frustration level, right? First you have the injury, then you have the frustration, psychological suffering of not being able to do what you want to do.
Which then
That's the
disrupts the
focus.
chi even more and creates,
Right. Now that starts getting into digestive stuff,
Right.
Physiology of the liver and the spleen and so on and
Right.
so on. So that's what I try to bring
Yeah.
it back to.
which is what's great about doing packages for patients,
Right.
because then you can say, okay, we're going to do twice a week for a month, and then we're going to reassess at the end of the month and see
Exactly.
where you are. And the goal is to get you on to a maintenance plan so that you're not in here twice a week for the rest of your life or whatever is going on. And that when other things come up, you've already been taking care of your body, and we can tackle it a lot quicker when that happens.
Yep.
But lest people think that we do all the work, because I just feel like we facilitate part of it. We're just there to, kickstart the healing, but it's up to them. I give my patients homework.
Yep. All
How
the
about
time.
you?
Yep.
So I think you had mentioned your shoulder patients, you give them stretches, your neuro patients, you give them, sometimes they're,
Depending on which the neurological issues can range from a vision problem to a voice problem to walking or activities of daily living using their hands.
Okay.
So it really depends on that person, what we're going to focus on first. What's more important, that they be able to walk down the hall or that they speak? So
And
we
then from
we
there.
need to focus on their gait and,
Okay.
and walking and stuff like that. I mentioned something called Brain Gym, which you can find on the web. Lots of little exercises where we're stimulating the brain to recreate or at least enhance the connections that they have.
Right.
Right. A lot of crossing of the midline, if you know what that
Okay.
means. Right. That does a lot for brain function.
Left, right brain.
And they do a lot of that with kids
Yeah.
with ADHD, with autism, Asperger's,
Yeah.
etc.
So for me, a lot with the gynecological stuff, a lot of it is changing diet.
Diet.
Oh
Yeah.
my gosh.
Yeah.
Again, back to the sugar.
Yeah.
We all love it, but it causes inflammation and it wreaks havoc. And again, digestive stuff, having people change their diet. And we'll talk about in future podcasts the temperature of foods and how we look at foods differently. In my background, my undergrad that I needed to become an acupuncturist was in nutrition. And Western and Eastern nutrition are very, very different. In Western nutrition, it's all about counting calories and measuring things out.
Right.
And in Eastern medicine, we talk more about the temperatures of foods and eating at the right
nature.
time of the year and nature and what's indigenous to where you're living. And yes, commerce is great in that it's brought us foods that we might not normally eat, but at the same time, it might not be the time of year you should be eating that.
Right. Yeah. That's why I said the nature of the food. Whether,
Yeah.
is it astringing? Right? Is it cloying? Does it help build up
Right.
like your mom needed? Your mom needed to build up,
Right.
to be at a healthy weight.
Right.
Some people need to take some away and be at a healthy weight.
Right.
There's a balance. In Chinese medicine, you can be overweight and underweight.
Right.
Not at the same time, obviously. But you can also have high blood pressure and low blood pressure. Like we don't
Right.
think in the West, we don't think about low blood pressure as being a problem. That's a
Right.
problem. Low blood sugar. We know that's
Yeah.
a problem. High blood sugar, we know that's a problem.
Right.
All those things, if you're eating the right diet, you're balancing those.
Right. Yeah. Yeah. I mean, if someone has high blood pressure and they're eating greasy, fatty foods all the time, they're also putting a strain on their heart. And it just overall, you're not really nourishing. So another thing that I wanted us to chat about was why it works for so many different concerns, and that we, again, are looking at the whole person. So you're not just a headache, and we look in the textbook and say, okay, well, these 10 points are good for headaches. It's the person in front of us that has the headache. And do they have a headache because their digestion isn't good? Do they have a headache because they're blood deficient? Do they have a headache because they have high blood pressure? And even if it is those things, we can break it down and say, just because it's high blood pressure for someone, that they might not get the same points as the next person.
Correct.
So we very much are looking at the person who's in front of us at the time. And we also thought it was important that we should share what to expect from the treatments.
Sure. Yep. I always tell people to dress in loose-fitting clothing so we can get to the points. And for the most part, what I treat is knees down, elbows down.
Yeah.
Maybe some abdomen points
Yeah.
for some digestive GYN type problems. Other than that, the face, the scalp, the ears. That's kind of it. I try not to have anybody disrobe. That's
Yeah.
just my style. Some people will walk in my office and strip down to their underwear, and I tell them
You don't
not
have to.
not necessary.
Right.
But it's part of their culture. Like they have no
Right.
problem. I'm going to the doctor. I'm just going to strip down to my underwear.
Yeah.
Okay. Then after a while they realize, okay, or they'll wear shorts or something like that is fine with me. Sometimes I have to get to the gluteus maximus and the minimus.
Yeah.
And some people are great with that. Other people are a little more modest. But
Yeah.
we're in a medical office, and that's what we do.
Right.
So what we want is results. I want people to really feel comfortable.
Right.
In the office,
And that they
I
are
really-
laying down.
Yes.
They're usually, occasionally I have someone who's sitting, but most of the time they're laying down. And that you don't get up and walk around with the needles in. You stay laying down.
Right.
Like I usually.
Don't take your needles out, please.
Right. Being from Jersey, I try and add as much snarkiness as I can into the treatment room. So like I do that as I'm walking out the door. Is everything comfortable? And I'm like, don't try and get up and run away. I'll come back. The first time they come in, I check on them, but usually after that, people
Right.
don't. On subsequent visits, they just want to relax. I use the baked potato blanket. Do you use the baked
okay.
potato blanket?
Yes.
So it's
I
like a
have them.
Mylar blanket that doesn't push the needles in. So
super
the runner's
light.
blanket, yeah.
Right.
And
Yeah.
I call it the baked potato
The
blanket.
baked potato. I
Yeah.
didn't think to call it that. That's good.
Yeah.
But I will say,
Yeah.
you're done. You're baked. You're cooked.
I'll come back when you're cooked.
Time to turn the turkey over. Or
Yep.
something like that. But one thing I always tell patients the first time is, do not lie here uncomfortable.
Yes.
Right. Let's say I put a needle in their arm or their hand, and they went to scratch their nose or something, and now it hurts.
Yeah.
It almost never happens. But I tell people, please call out.
Right.
No one will be offended. You're not going to disturb anybody else.
Right.
Let me know. And it almost never comes
Right.
to that. But every once in a while, there's just one person who will do that. And they'll say, I was in pain. I said, why didn't you tell me?
Right.
And the reason I do that is a friend of mine went to some very well-known acupuncturist in New Jersey. And the guy put a needle in his calf, probably
GB34 or stomach
maybe
36.
something like that, and it hurt, and he laid there for 40 minutes in pain
Yeah.
with like rice paper walls between the treatment
Oh,
rooms.
no.
He didn't want to scare anybody or offend anybody, so he didn't tell the guy, and the guy
Yeah.
kind of forgot about him. And when he finally came back, he's like, yeah, my leg hurt. He's like, oh, you should have told me, and just pulled the needles out and sent them on his way. And he never went back because it was
Yeah.
painful. His experience was that it was
Right.
painful, which was completely
Not how it should be. Yeah, I tell people they should be able to fall asleep. In fact, when I'm putting them in and I ask if everything feels comfortable, and same thing, I want them to call me if it doesn't. I feel like if that's all you're thinking about for 30 minutes is that one needle that hurts, that's more of an issue than me walking back in the room, because I feel like you're not going to relax. And not that the treatment won't work, but it's so much more effective if you can get into the zone, that like acupuncture drunk kind of feeling. And you do feel so relaxed. And I want them there because I feel like it works more.
Yeah.
We also talked about mentioning, just so people are aware, don't discredit acupuncture if the first practitioner you go to isn't a good fit for you. I mean, I think, was it you who used the analogy of dating? You may go on a date and find it's not the right person, but you're not going to
that
stop.
wasn't me.
Oh, okay. So somebody had said that to me at one point, that it's sort of like dating, and that you have to look at it as, you might not find the practitioner who's right for you on that first visit, and to be open to the idea that it's not that acupuncture. And again, I feel like everyone tells me they leave feeling relaxed. I get a little disheartened when someone says, I tried acupuncture, and they're like, it didn't work, but they've only tried it once, and they didn't follow through with a treatment plan, or they didn't try another practitioner. So being open to the idea of, you might not find that good fit I of course want everyone who comes to see me to love me immediately. And I want to be their practitioner, but if I'm not, I don't want them to not, to not try it again.
Right.
That there's even though there's not a lot of us in New Jersey, there's other ones out there. And, my hope is that people will listen beyond New Jersey and try acupuncture and search out other practitioners if they don't find the right one. So anything else you wanted to share today?
After a treatment, I tell people, try to take it easy that day.
Yeah.
Right. I definitely tell orthopedic people, if they feel better, to not go lifting things.
Yes.
I had an elderly woman. She had to be in her 80s. Gave her a back treatment. Got off the table. She was nice and felt limber and great. She emptied her attic that afternoon.
Oh no!
And wound up just as bad as
Yeah.
the day she came in.
No,
I said, I told you, but I felt so much better, she said.
Yeah.
And she just insisted on being active because it had been so long, and she
It's-
needed
I
to
was
clear
just
out
gonna
her
say,
attic
it
and
was
such and
probably
such. I had another guy mow his entire lawn with a push lawn mower,
wow.
front and backyard. And, it wound up in agony.
Oh, that's bad. Yeah, not good.
But the other part of that is, after a few treatments, they can do something like that.
Right.
And their recovery time actually improves.
Right.
Or they don't feel as bad.
Yes.
Or they don't feel bad at all, hopefully.
Right.
That's the best outcome. It really depends on how long the problem is there and stuff like that.
Yeah.
I always tell people that, the reaction they're going to get is a product of how bad the problem is, how long it's been there,
Right.
how much they've taken care of themselves, or how much load they're put on themselves, right?
Right.
If they're drinking a bottle of whiskey a day and they're sedentary and they've got lower back pain, which probably means they have lower GI issues too.
Right.
Yeah, we're not going to see that much results here unless you stop. You know,
Right.
I actually turned away a patient who was a skier. And he said, well, I'm not going to stop skiing. I'm going to go skiing every weekend. I always fly out to Vail every weekend and I ski. And so I'll see you during the week. And I said, well, that's not really going to work because you're just going to keep re-injuring your shoulders by polling.
Right.
And he's like, yeah, I really pole a lot and all that stuff. You know, it was pretty obvious between the two of us. And I said, I don't think I can really help you if that's
Yeah.
what you're going to do.
Yeah.
And he said, okay, I'll find somebody else. Please do.
Right.
Okay.
Yeah, I try and be as upfront as possible. I feel like, you know, if I know ahead of time that I see that someone is not going to follow through, I just feel like they're wasting their time.
Yeah.
And I don't want to do that.
Yeah.
I want to work with people who want to, not that they have to follow everything. I mean, there are certain things that I feel like you have to make small changes with. If somebody is drinking a liter bottle of Coke, I'm pretty sure that I'm not getting them to stop drinking that liter bottle of Coke every day when they leave my office. But I'll say to them, how about you pour 1 cup of it out and don't drink that 1 cup and let's get off of the amount of like crappy sugar that has no nutritional value at all.
Right.
So.
And this gets back to priorities, right? Of having them set priorities of what they really want.
Right.
And the acupuncture treatments are just part of that plan
Right.
for them to get healthy.
Yes.
And they're not going to get healthy just by
Right.
taking acupuncture.
Right.
You know.
I mean, I wish I could do that much.
Wouldn't that
but
be great?
I would be amazing, but
It'd be $1,000 a treatment 1 day a week.
Exactly.
So
our next, well, should we check and see if there are any comments that we should have addressed? I think it was just like a ton of highs. So hi back to everybody. Yeah. And it was just an introduction. We're going to definitely ask people to be more interactive in our future podcasts. I'm going to share that our email for the podcast is practicalmedicinepodcast@gmail.com. People can also message us through the Facebook page, the Instagram page, if they have questions or topics that they want Rob and I to discuss. We definitely
Sure.
want to see what people want to learn more about.
we have a long list of things to talk about, but we'd love to hear from you
Right.
of what you would like to
What
hear
everybody
covered.
else wants to hear.
And we're going to have some guests over
Yes.
time. There's no shortage of awesome people that we work with.
Yeah.
That, I'd love to have come on and talk about conditions or
Specialties that we don't
specialties
cover.
and styles and stuff like that. Yeah.
Yeah.
Yep.
So our next podcast is scheduled for Monday, October 5th at 7 p.m. And we're going to talk a little bit about what to do in the fall, because there is this seasonal component of Asian medicine that you want to eat with the seasons and exercise with the seasons and prepare for certain things that change in terms of the weather during the season. So we're going to chat about that. And then the subsequent podcasts, we're each going to talk about our specialties.
So for the 5th, Monday, did you ever notice that when it's 60 degrees out, you're freezing?
Yes.
Right? And when it's January and it's 40 degrees out and you go outside, you're like, wow, it's nice and warm.
Right.
We're going to explain how all that works.
Right.
And what you can do to prepare and stay healthy through the season. Because this is a time where a lot of people get sick, right?
Right.
Around with respiratory problems.
Yes.
There's a connection there too.
Right. So we're going to chat about all of that. So thanks everybody for listening, and we look forward to seeing you in like a week and a half. And our new time we're going to try and stick with Mondays, because we think that'll be a good time in the evening, end of the day. People winding down can listen after dinner.
That's right.
All right.
Thank you.
Thank you. Have a great day.
The contents presented during the Practical Medicine podcast include information about various modalities that exist to achieve health and wellness and are for informational purposes only. You acknowledge and agree that the following disclaimers and warnings shall apply to all content presented.
The podcast contains the opinions of Dr. Robert Balko, DAC, LAC, and Dr. Stephanie Lipnicki, DACM, LAC, and the guests of their show. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding any medical condition.
The views expressed in the Practical Medicine podcast are our own and do not represent those of all licensed acupuncture professionals. Always seek the help of your own acupuncturist or medical provider to determine your best course of action. You may want to use the information presented as a supplement to better understand your diagnosis or treatment, but it should not be the sole thing that you use to make important medical decisions. Do not use the content of the podcast in lieu of medical advice.
Never disregard professional medical advice or delay seeking care because of something you have heard on this podcast. Privacy is important to us, thus all people, places, and scenarios have been changed where applicable to protect privacy and maintain confidentiality.